So codeine abuse is said to be on the rise in the country. The medicine, which is usually used in cough syrups and painkillers, is said to be used for recreational activities to get high. So the South African Health Products Regulatory Authority has drafted new guidelines on the sale of codeine to help curb the abuse. So let's speak to SAHPRA Senior Manager of Inspectorate and Regulatory Compliance, Deon. Poovan. Deon, good morning to you. Thank you so much for joining us. My understanding is that even rehab centers in South Africa have been admitting an increasing number of codeine users. Let's start with the basics. What is codeine? Where is it found? And how big is this, recreational use that we're now seeing?
Good morning, and thank you for having me. So codeine is what we would call an opioid. So it is a substance that is related to the opioid morphine, and there's a wide range of opioids that are out there for clinical use, for pain management. You can also use codeine for cough management, but it is a valid sort of clinical use that it has, and that is what codeine is. It's basically a painkiller.
Okay, and we find it in cough syrups and medicine that for the most part we're able to buy just to cure our flus. But what's the issue now? At what point did it become such a problem that SAHPRA needed to step in? I believe one of the big issues is, of course, really needing to make illicit bulk sales of codeine-based cough syrups illegal.
So the bulk sales of codeine cough syrup at a wholesale level is not illegal. How codeine in Schedule 2 medicines are controlled is that it is available over the counter, but that over the counter is subject to the pharmacist dispensing it to the patient, and that obviously is under pharmacist-initiated care. What we're finding is that there's more and more anecdotal evidence that there's misuse and abuse of this Schedule 2 medicine. And what we find during our investigations, that often there's bulk sales that are happening at the retail level, which should not be the case. It should be patient specific. So what our efforts are as the South African Health Products Regulatory Authority, as well as other stakeholders, is to try and determine what exactly is happening at that level, what is happening at the wholesale level, and what is happening at the manufacturing level. Because the way medicines are controlled in terms of the Medicines Act is that once they are manufactured by a pharmacist, they are sold to a pharmacist in the wholesale sector, and who then in turn sells that to an authorized dispenser who is either a pharmacist or a licensed dispensing practitioner. And what we're trying to understand is, where is it going out? How is it being sold? Is it being sold correctly?
Yeah, and so what you're doing is you're speaking to some of the companies and health workers to understand how much they're producing?
Yes, so what we are doing now with the recent guideline that we set out, and this guideline is how we will request information related to the selling of medicines. And it's basically using the current legislation to determine for a limited time period, if we ask how many codeine units are being sold at a manufacturing level, how many are being sold into the wholesale level, and then trying to determine how many is being sold into the retail level, so that we can see if there are any diversions, which then lead to misuse and abuse.
I'm interested, just looking at some of the numbers here, right? 94% of doctors surveyed agreeing that patients don't fully understand the risk of dependence on codeine, and yet you're seeing young people mixing it with cool drinks and drinking it recreationally. So it seems that there's a lack of information as well with how practitioners are concerned in being able to speak to patients, right?
Yes, and that is exactly one of the initiatives that we are also doing. So it's not just about tracing where the product is and how it gets out of the system. The initiatives that we're having under the Codeine Care Initiative is with other regulators as well, such as the South African Pharmacy Council, and with civil society, to not only look at how medicines are being regulated within the supply chain, but also to inform the public as to how to use this medicine responsibly. This current stance that SAHPRA has in terms of the control of codeine containing over-the-counter medicines is that there is a place for it for legitimate use by people who actually need it without going to a doctor for a prescription. So it's very important that we educate the public as well as the healthcare professionals on the responsible use of codeine.
Okay, so understanding that you do have a black market that has already been established, unfortunately, and what is it? I'm just looking at this right now. Since 2019, rehab admissions for codeine have tripled. So obviously, we've got a serious problem on our hands. There shouldn't codeine then be, issued out by prescription only?
As I've said, SAHPRA's stance and what we've looked at when we evaluated this is that there is still a clinical use for over-the-counter, and so that people don't have to go and get prescriptions in order to get the substance for what they need it for, such as, minor pain management, as well as the management of cough. So there is a place for it to still be utilized over the counter for those that legitimately need it. And we need to manage those that are getting it for illegitimate reasons, for abuse and misuse.
Yeah. Can we talk a little bit about signs for parents to look out for? Because, when we talk about alcohol abuse, for instance, we know exactly what that looks like on a young person. A lot of drugs we may very well understand. Codeine, on the other hand, something that people may not understand because a lot of us, we've got painkillers and cough syrup in our homes. How does a parent or a family member start to realize that this is becoming a dependency? Do we have, some of those signs to look out for?
Yeah. So the common signs of dependency, especially within young children, is basically a change in personality, even their physical traits in terms of the lethargy and those sorts of things. So those are the things that parents need to look out for. Is there any sort of change in how they behave? And then they need to refer them to the correct healthcare professional for treatment.
Yeah. And what does treatment look like when we're dealing with a codeine addiction?
So a treatment would have to be under the care of a healthcare professional in the rehabilitation facilities.
Yeah,
and they would decide to treat that.
Yeah, and we need to talk about just how addictive it is because, we don't want a situation where now people are afraid to use some cough syrups because of how likely addictive they are.
Yeah. Look, the misuse and the abuse of a substance will most likely lead to addiction. But if you are using it for the correct purposes under the supervision of a healthcare professional, then you shouldn't have a problem. So it's important that when you are taking codeine, that you actually have that discussion with your pharmacist or your dispensing practitioner who is dispensing that to you. And if you are addicted to the substance and you have recovered from addiction, it's important to also inform your healthcare professional of your addiction to that so that they do not prescribe or give this to you.
Okay. Is there a resource that we can use to educate ourselves a little bit more about this drug that seems to be sweeping the nation and becoming quite a bit of a problem if it's seeing rehab admissions triple since 2019?
Yeah, so SAHPRA and with all these other stakeholders are working on resources to educate the public, and that will be made available.
All right. We really do appreciate your time. Thank you so much for speaking to us. Deon Poovan is the Senior Manager for Inspectorate and Regulatory Compliance with the South African Health Products Regulatory Authority, speaking to us about addiction to codeine, which is found in cough syrups and in painkillers, but now being used quite a bit by young people for recreational use to get high. Allegedly, what they're doing is mixing it with cool drinks and then consuming it that way. You'd imagine, of course, this is something that a lot of them would have seen in American pop culture as well. So something certainly to keep a close eye on.